Hello, everyone, and thank you for tuning in. In this episode, Dr. Latanya Benjamin will share some highlights and clinical pearls regarding pediatric skin of color and atopic dermatitis. Welcome, Dr. Benjamin.
Thank you. Thank you for having me.
Dr. Benjamin, can you tell us about the number of emerging therapies for treatment of AD in pediatric patients and how this will change the treatment landscape?
Absolutely. There are so many new therapies currently being studied and under development that I'm very excited for our patients that are suffering with atopic dermatitis. So traditionally speaking, I would think that atopic dermatitis, you could break it down treatments into 4 categories. So we have our topical therapies, we have our systemic therapies, phototherapy, and now the biologic group. And that's expanding as every passing day. And so this is very, very exciting. What's particularly exciting, even in our topical therapies, traditionally we only had topical steroids, and now we have evolving categories of non-steroidal creams and ointments that we can now apply to our children, now even infants. So the phosphodiesterase E4 inhibitors, we have this now approved in children as young as 3 months of age. So now we have a non-steroidal therapy that's topical for our infants. And as far as the biologic categories, we have game changer. We all know about dupilumab and the targeting of IL-4, IL-13, important cytokines in the pathogenesis of atopic dermatitis. We have other key proteins, cytokines that we're targeting with JAK inhibitors to minimize inflammation, and various other pathways that are currently under study and being explored. So not only do we have options now for our patients with injectables, we also have topical therapies and soon to be oral therapies.
Dr. Benjamin, what is your personal approach to treating AD in pediatric patients with skin of color?
My approach is to be very cautious about making generalizations about the degree of inflammation that's in their skin. So for example, when we meet atopic dermatitis patient with skin of color, it's very easy to see, oh, they're just dry. But I take that next step and really try and search for the degree of inflammation and suffering that they're undergoing, because sometimes children won't necessarily communicate with you that they're very itchy or they become accustomed to that as their baseline degree of itch. And so they're not forthcoming that they're still itching at night, having difficulty sleeping, scratching until they're bleeding in the morning. And in skin of color particularly, you can't necessarily judge the degree of inflammation because of the competing chromophore, right? So we don't necessarily see that erythema, pink or redness very early on. And specifically in skin of color, children tend to have a lot of chronic lichenified plaques. And so analogous to psoriasis, where you have that thick micaceous scale and you can't necessarily appreciate the degree of erythema beneath it, lichenification, this chronic itching and rubbing that these children are undergoing, really hides the erythema and the inflammation in skin and color. So I really take additional time to really look at the skin beyond the dryness and really search for the degree of itch that they are, so I can appropriately categorize them as being mild, moderate, or even severe, and manage them appropriately.
Can you share some advice for dermatologists on communicating with parents and caretakers of pediatric AD patients regarding treatment options and at-home interventions?
Sure. I think as a dermatologist, oftentimes we're so focused on the high-tech technology that we kind of miss that important step of the basic skincare. And I think we should really take a moment, especially with a chronic disease, to explore basic skincare again with the folks, right? So you have a young preteen or adolescent or teenagers, oftentimes they've given up by this stage, and they're not wanting to use their topical, ointments and creams anymore. So I really take time to help the caregiver oftentimes realize what the child is actually doing or not doing. So the kid would be the first one to admit that they're still using hot showers. The moisturizer, yes, mom or dad or the caregiver has put in the bathroom, but they're actually not reaching for it. So like sunscreen, right? It's not going to work if it's not being used. So I really review moisturization because that's typically key. And I want to know if they're using their product, and if not, why. So if it's the texture, some have sensory issues where they prefer creams and they can't tolerate ointments, even though their skin kind of need an ointment-based moisturizer. I really explore that with the family and tailor to them the right moisturizer that the child would actually need, prefer, and use. So oftentimes in the clinic, I'll have samplings of different moisturizers that I recommend and have the kid try it right there and tell me how it feels on their skin, if they're comfortable and willing to try that at home. To answer the second part of the question, so that's at-home therapy. And I think the other thing regarding medical therapy to the family is to offer them hope. There's so much new therapies emerging and on the horizon that if they're not comfortable necessarily with a certain form of administration of a medicine, for example, injectables, that there are topical medications, even oral medications that are soon to be available, right? That's the hope. And so I think it's very encouraging to let them know as a family that they have options. We can explore what will work for their home and family life. Some families actually prefer the concept of really only having to address this chronic state twice a month with an injectable. And so believe it or not, we do have young pediatric patients that don't want their skin condition to affect their sports or their daily activities in life. And so to really focus on their therapy only twice a month, as opposed to a topical medication or cream that you're focusing on days and weeks at a time, can be appealing.
Thank you. And final thought, is there anything that you would like to share with us, Dr. Benjamin?
I think my final thought is for us to remember how important the itch is and to assess that. I find a lot of families come to me because they have all the right treatment and therapies going and skincare and so forth, but no one's really properly addressed the itch. And I know there's controversies and some dermatologists may not believe in the role of antihistamines, but we have children that really respond to certain antihistamines. Sometimes the itch, as we all know, could be driven just by simple xerosis. So addressing where is this itch coming from? Is it simply that they have dry skin that's triggering them to enter back into that itch scratch cycle is key. So I really take the time to figure out where's that itch. As I tell my families, I don't want to just throw lotions and potions at you because it only takes one scratch, one ripping of the skin to really set us back and start this all over and not get the results that they deserve. So really looking at the family, looking at the skin, where's this itch coming from? Is it because it's allergic mediated? I need help with to co-manage with my allergist. Does this, child require desensitizing shots? Is it really just a matter of dry skin and xerosis where they need extreme moisturization? Or if it's more immunologic and they need help with the antihistamine, where is this itch coming from? Because there's so many secondary consequences of it, whether it's sleep disturbance in the patient, the parent, lack of focus at school, just being depressed and miserable. There's so many sequelae of the itch not being under control. And I think that's really my plea, is to not forget about that, whether it seems rudimentary or basic. Really knock out that itch for that family, that child, because that's everything. And the skin will follow.
Thank you so much, Dr. Benjamin, for sharing your insight and expertise with us. We appreciate you and your time.
I appreciate being here. Thank you for the opportunity to speak with you all.
Thank you. And we would like to thank all of our listeners. Until next time.